Mr. Speaker, I rise on this occasion to make two statements. I will make a statement in my capacity as Minister of National Insurance and a statement in my capacity as Minister of Agriculture. First, Mr. Speaker, at page 18 of the Team Unity Manifesto, our contract with the people of the Federation, that's what it is, we recorded our commitment in the following terms. It is our belief that the wealth of a nation is the health of a nation. Team Unity government will, within its first term in office, commission a comprehensive national health insurance plan for all citizens of St. Kitts and Nevis. 2, work with Social Security, employers and trade unions to work out the best mechanism for the development of the scheme and the payment of premiums via payroll contributions taken from our manifesto. Given that commitment, Mr. Speaker, my duty is to help this government to deliver this proverbial baby, the baby that promises so much for all persons across this nation. Since the turn of the century, the talk of universal health care has accelerated globally. I have traced the increased discourse in St. Kitts and Nevis, however, back to 1989, when I first introduced the concept of universal health coverage to the government of the day for all public servants. It is a benefit which they still enjoy today. In 2004, however, I made it central to my campaign, and then I increased the tempo in 2010, and the opposition now, then in government, embraced the concept and included it as part of their campaign agenda. As fate would have it, Mr. Speaker, the honourable member for St. Christopher too, or those around her, if she takes any objection to what I'm going to say, began working to implement a program of universal health coverage in St. Kitts, if not the entire state. A draft submission to Cabinet, dated August 6, 2014, outlined as its objective, quote, to maximize and sustain universal access to essential health services of assured quality, while ensuring financial risk protection to all. Mr. Speaker, when I was appointed as Minister of National Health Insurance, I began working on how to deliver universal health coverage to all. That being a major part of the Team Unity agenda. Indeed, I will say, Mr. Speaker, part of the country's agenda. I say country's agenda because not only has Team Unity outlined this in its manifesto, but so too has the opposition embraced the concept. A few years ago also, Mr. Speaker, in 2011, a Social Security Reform Committee found favorable responses from among stakeholders who attended consultation after consultation across the country. Participants effectively supported salary deduction of up to 2% to implement universal health coverage nationwide. So, Mr. Speaker, for all of that, for those reasons, is why I now say it is the country's agenda. Not only a Team Unity agenda, but the entire country's agenda. And I must confess, Mr. Speaker, that I spend endless hours employing my technical skills, sometimes to 3 a.m. without sleep, attempting to get the program right. Combing the national health statistics of 2011, examining the country's health profile over several years, studying the health programs of the top 16 countries around the world, Canada, Qatar, France, Norway and its Scandinavian counterparts, New Zealand, Belgium, Germany, Israel, Australia, Hong Kong, Sweden, Netherlands, Japan, Switzerland, Singapore and Luxembourg. Reviewing the work also proposed by the previous administration. And I believe I came up with a dream program, one which looked at capped schedule of benefits, leaving room for the private sector's health coverage program, their Rolls-Royce program that they would like to market to all consumers. A program that we came up with was to be funded from many sources. Of course, payroll contributions, sin tax, lotteries and gaming, etc. But then, Mr. Speaker, in 2016, after months of work applying my technical skills, and after getting Cabinet to appoint a local committee of representatives from both St. Kitts and Nevis, it was counseling with one of my Cabinet colleagues when the path forward was revealed. As a result of that counseling session, Mr. Speaker, my ministry engaged the University of the West Indies Health Economics Unit, headed by Professor Carl Theodore. The initial contact with the university was made on September 9th, 2016. Since then, we have had members of that unit of the university visit St. Kitts and Nevis at least 4 times. They have met with the local committee, professionals in the health field, officials in various ministries, members of the Social Security Board, and other stakeholders, including an overseas actuary. A proposal for the provision of consultancy service for advancing action on the design and specifications of a national health insurance system for the Federation of St. Kitts and Nevis was received by us. It was dated February 13, 2017. The proposal was discussed by Cabinet, Mr. Speaker, resulting in my ministry seeking input from Dr. Didicus Jules for his regional perspectives, given the fact that regional discussions on universal coverage commenced at the OECS heads meeting during 2016. Cabinet went further, Mr. Speaker, and obtained input from PAHO through its representative, Dr. Peter Cowley, based in Barbados, who is the lead spokesman on universal health insurance matters. Cabinet went further and obtained the local committee's analysis of all of those proposals and recommendations, and took recommendations from the local committee itself. Mr. Speaker, that brings me today to what I really would like to declare to the public, to announce that my ministry and the government is ready to embark on a public engagement that we trust will culminate with the launching and implementation of the National Health Insurance Program and its primary outcome of access to universal health care for all. As I make this ministerial statement today, Mr. Speaker, I urge everyone to appreciate the need for this important program. Mr. Speaker, I delivered a copy of my statement to you, so I want you to follow along with me, because the country must understand what is national health insurance. Mr. Speaker, with your permission, I would outline that it is a national system, a proposed national system of shared contributions and prepayment by persons for a package of health services to meet the health needs of the population. There can be variations. Based on consultations with the public, you will have variations. But fundamentally, that's what it is. So, why is national health insurance needed? Mr. Speaker, many persons, because of limited earnings or are without health insurance, they lack full access to health care because of the high cost of care, not only in the Federation, but across the world. Because of the rise of chronic diseases in our population and the high cost of putting all the facilities and services in place of the right quality, government alone can cover all the costs for care for everyone. It will bankrupt individuals, it will bankrupt government as well. There is therefore a need to find a mechanism to share contributions for the healthcare across the country for those who can and cannot pay, for all persons who will seek care not only locally but perhaps internationally. Mr. Speaker, what are the links between national health insurance and universal health care? Because we've used both terms over time. You see, Mr. Speaker, we believe that universal health care is part of the new Sustainable Development Goals 2015 to 2030. And we in this federation have agreed and accepted those Millennium Goals. So it is part of those goals why we in the federation are pursuing this healthcare and universal healthcare and national health insurance program. Also, Mr. Speaker, universal healthcare requires progressive action by governments to ensure barrier-free access to quality health services for all persons, so that no person is denied access to care because of his inability to pay. Over many years, Mr. Speaker, you've heard me relate the story of a young man from Keys, Mr. Livingston Griffin. He has members of his family who work in this government. Livingston, Mr. Speaker, was a young fisherman. He was only 34. But, Mr. Speaker, as fate would have it, he had an operation, a successful one in this federation. But, Mr. Speaker, he was asked by his practitioner to travel to Trinidad and Tobago for 21 cycles of chemotherapy. At the time, chemotherapy, Mr. Speaker, was not available in St. Kitts and Nevis. At the time, not even Antigua nearby would provide that chemotherapy. So to Trinidad he will have to go. Those 21 cycles, Mr. Speaker, was costing him more than $30,000 US. This is a young man, partial fisherman, no protection, no insurance. And Mr. Speaker, I watched that young man at 34 pine away very painfully, very, very painfully, and died a painful death, all because he was in no position to access the health care that he needed. I remember him, Mr. Speaker, going across the country with a sheet of paper asking for contributions. And some of us in this parliament, there's only give $50. You know? But, Mr. Speaker, the $50 was not enough to take him to Trinidad and Tobago. And so, Mr. Speaker, it is for that reason, those reasons why I am passionate about pursuing and inviting the country to pursue universal health insurance in the Federation of St. Kitts and Nevis. Mr. Speaker, I know a young lady. I saw her born. I played football and cricket with her father. Akila Libard, she worked in the government, just got into the government service and was not yet enrolled in the health insurance program for the government. And Mr. Speaker, 2015 when I came to office, she was a bright, sprightly looking young woman. And you know, Mr. Speaker, I'm serious. I mean, she was like a star. Anything you can say beautiful about a young woman, she was. Mr. Speaker, she's dead today, you know. Today, as I speak, she is dead. You know what happened, Mr. Speaker? She was diagnosed with cancer. Had an operation at our hospital here. Needed chemotherapy. Needed radiation. Went to Antigua. Mr. Speaker, I still have my signature on a bill for the center in Antigua for $11,000 US. Pined away painfully and died. Because at the time she could not afford it and I had to sign. So a bill is there to be paid. I'm saying, Mr. Speaker, ordinary people in this federation, ordinary people should not find themselves in that predicament. When health care is needed, individuals must be able to have barrier-free access to the care that they need. Mr. Speaker, how will it work? How will it work? We expect all eligible persons residents as well in the Federation, to be registered under the scheme. And contributions may be shared with employers and in some cases government. We expect the NHI agencies to sign contracts with the health service providers, like the hospital and the doctor's offices, to be on the program, to provide the services. When healthcare is needed, the members visit their health professionals, their practitioners, and present their membership card. Less money walking around with. Use your membership card. We expect the bills to reach the health services of the NHI and to be paid. Mr. Speaker, those will come out when we roll out the program just now, leading towards the formulation of the program and implementation, because we expect the engagement of the entire public in this program before we say we are launching the program today. Everyone must know what we're doing. Everyone must understand what we're doing and how we're going to do it. That is going to be our approach, Mr. Speaker. And can St. Kitts and Nevis afford this? Yes, Mr. Speaker. St. Kitts and Nevis is already spending a significant amount on healthcare. The 2011 National Health Statistics show that we spent over $117 million on healthcare in the Federation. The projections up to this year show that we're somewhere in the vicinity of 180 million. So can we afford it? We're already spending that across this nation. It is a harmonization of that and efficiencies in the system that will help us to be able to deliver these services and reducing the cost to do so. Yes, Mr. Speaker, St. Kitts and Nevis can afford this. The key role of the stakeholders, Mr. Speaker, we believe that the Ministry of Health has a significant role to play to deliver quality health care, improve its quality all around. Many persons complain about many things. This introduction of universal health care, national health insurance, will help to guide a process that will increase efficiency. By example, Mr. Speaker, you would not be able to go to Dr. A and get a prescription for this, and then go to Dr. B and get the same prescription, because the system will flag you that you have had that prescription just a day ago. Abuse will be taken out of the system. So it is that kind of efficiency that we want to introduce when we introduce universal health care. Yes, Mr. Speaker, we expect the Ministry of Finance to keep a watchful eye over the business operations of the National Health Insurance. We're not doing this in isolation, no silo. The Ministry of Finance has an important role to play. And we expect that role to be played by the Ministry of Finance to keep a watchful eye over the operations of the NHI. Of course, employers will assist, if we come to deductions, will assist in the harnessing of those deductions and make sure that it is channeled in similar fashion to how Social Security is channeled. And the workers, even if you're not on a salary reduction employment, will make contributions if that is the road that we follow when the whole program is established, Mr. Speaker. So, Mr. Speaker, having said all of that, let me conclude this statement by saying to the general public that the University of the West Indies Health Economics Unit will spearhead this project from the start, working with the local committee that will be further strengthened by including other stakeholders. And they will engage all stakeholders across the country. Persons who have interest will be invited even to send papers in, and there'll be meetings. And we expect a robust meeting with the members of the opposition. Because, Mr. Speaker, as I said earlier in my presentation, this is a national event. This is not just only Team Unity's event anymore. Team Unity has proposed it and will implement it. But we expect a national approach to this, and we look forward to the engagement of the former Minister of Health and her team, and welcome her ideas, so that this program can be implemented successfully for her constituents. Yes, Mr. Speaker, that's what we expect. And so, Mr. Speaker, our approach is that in the end, there will be no person left behind, because this government promises a fair share for all.
Stay up to date with news, programs, and activities of the government with SKNIS. Like us on Facebook. Listen to us on SoundCloud. Follow us on Twitter. And watch our videos on YouTube. Connect with us today. SKNIS, St. Kitts and Nevis Information Service.